This is part 2 of my videos on spinal stenosis. So if you missed part 1, go back and check that out. Today, this video is specifically going to focus on the 4 most common causes of spinal stenosis and treatment options. So this is an MRI showing a large disc herniation at L5-S1. That big black part is the disc herniated out into the spinal canal, and that can put pressure on the central canal, the lateral recess, or the foramen where the nerves exit. This MRI shows ligamentum flavum hypertrophy. So those little red lines are highlighting how thick the ligamentum flavum is, and that's the ligament that sits on the back side or the posterior part of the spine. As it continues to thicken over time, it creates pressure on the central spinal canal and the lateral recess. The arrows in this video are highlighting the facet joints. As the facet joints start to develop osteoarthritis, which is extra bone. So as you lose cartilage in that joint, your body forms extra bone to try to protect you. That extra bone actually puts more pressure on the spinal canal. So the extra bone takes up the space that the nerves would normally sit in and can put pressure on the central canal, the lateral recess, and the foramen or the nerve, the hole that the nerve exits from. This image shows spondylolisthesis, which is another common cause of spinal stenosis. That's where one vertebra is slipping forward on another, and there's some instability in the spine. That can put pressure on the nerves in the central canal and the lateral recess. If you see a pain specialist for any of these causes of spinal stenosis and they find these on your MRI, they're going to recommend physical therapy if you haven't tried that before. They may recommend medications like muscle relaxers, anti-inflammatories, or anti-neuropathics like gabapentin, Lyrica, or Cymbalta. If you don't respond to these initial conservative therapies, your pain specialist may recommend a trial of epidural steroid injections. Whether you respond to epidural steroid injections depends on how severe the spinal stenosis is and how chronic the problem is. For more chronic and severe problems, it's less likely that you're going to be a good responder. They may also recommend a trial of opioid therapy for symptomatic management to help control your pain. It can also be helpful to meet with a surgeon to discuss surgical options. The type of surgery that they would recommend or whether they recommend surgery at all depends on the cause and severity of your stenosis. And then lastly, if you've met with a surgeon, you've been told that you're not a surgical candidate, you haven't responded to conservative medication therapy, you either haven't responded to opioids or you don't want to be on opioids, there are more advanced pain procedures that could be helpful for you, such as minimally invasive lumbar decompression or the mild procedure or spinal cord stimulation.